Welcome to Healthcare Musings, a podcast dedicated to the discussion of critical care and healthcare in general. Here's your host, Dr. Hassaballa.
Hey everybody, happy to have you with me. Okay, so let me give you a case. We have a 48-year-old woman who presents to the hospital in rapid atrial fibrillation. They give her heart rate reducing medications in the emergency department. They reduce the heart rate for a little bit, but then the rapid atrial fibrillation recurs. So she is then admitted to the hospital for treatment of rapid atrial fibrillation. Multiple anti-heart rate medications are given without success. The rapid atrial fibrillation persists. So then she started on a continuous infusion heart rate reducing medication and transferred to the ICU. Suddenly, she develops shock, and then kidney failure, and then liver failure. Soon she's on dialysis, and she's requiring now multiple vasopressors to keep the blood pressure elevated without success. She started on dialysis. It's not successful. Her organ failure continues to progress, and she unfortunately passes away. What's her diagnosis? Not rapid atrial fibrillation, but actually septic shock. And that's the point of this episode, is in honor of Sepsis Awareness Month, which is September. It's my plea to make sure that we are always aware of sepsis. That patient, turns out, had myelodysplastic syndrome, which is a hematologic condition that can suppress the immune system, leaving patients vulnerable to infection, and that's exactly what happened in this case. Unfortunately, the sepsis was not recognized in time, and despite everything the treatment team did, the patient passed away. And that's the point. Sepsis is the great chameleon of life-threatening conditions. People don't present to the hospital saying, I'm septic. No, they present to the hospital saying, I'm weak. They present to the hospital saying, I'm nauseous. They present to the hospital saying, I have chest pain. They present to the hospital saying, I just don't feel well. They present to the hospital with altered mental status. And they can present to the hospital, like our patient, with rapid atrial fibrillation. We, as clinicians, always have to have a very high index of suspicion when it comes to sepsis. We always have to be on the lookout for sepsis because, like I said, it's the great chameleon. It can manifest and look like any other condition, and the problem is the slower we are to intervene, the more likely the patient will have a bad outcome with sepsis. I mean, research has shown that the sooner you institute antibiotics, the lower the mortality. If we're wrong with the antibiotics, the higher the mortality. I mean, it's just we always have to be looking out and thinking about sepsis because it can really sneak up on you, and before you know it, and if we don't intervene in time, the inflammatory cascade, the dysregulated host response to the infection gets out of control. It's like a wildfire. It gets out of control, and it just damages every organ system in the body, and it's too late. So, in honor of Sepsis Awareness Month, it is my plea for myself and all of my clinician colleagues to always be aware of sepsis, the great chameleon of life-threatening conditions. Thanks so much for your time and attention, and until next time, this is Dr. Hassaballa signing off on Healthcare Musings. Thank you for listening. To get every episode delivered directly to your inbox, please subscribe at healthcaremusings.com.